Welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
And I'm Mike Heffernan.
Mike, thank you so much. Dr. Heffernan, thank you so much. Dr. Heffernan is a cardiologist, and we're very lucky to have him here with us today. And we're going to be discussing
a really important topic. So it's going to be the top 5 signs you may be having a heart attack. So obviously, if you really think you're having a heart attack right now, stop this video and call 911. That's obviously the bottom line. These are going to be guidelines to that you may have a cardiac-related situation that's going on. So Dr. Heffernan's going to go through 1, 2, 3, 4, 5, and then a couple of atypical ones at the end. So let's start with number 1. What's the number 1 sign?
Now, I had a broken heart in high school
for
most of it. I suppose the signs and symptoms are very similar.
Pretty similar.
Okay. Good.
Yeah.
I wasn't
less
crazy.
crying.
Less crying. That's exactly what I was going to say. Less crying.
You must have been. So one of my close friends must have spoke to her.
That's exactly. Number 1, chest pain. So the chest pain can vary from individual to individual. I have heard it all over the past 20 years as to what the chest pain can be described as. But as a general rule, most individuals will feel some tightness, some squeezing, some pressure. And actually, it's probably a bit of a mistake for us. We say pain, and the patients will often correct us, say this is not pain.
Right.
It's a pressure, it's a tightness, it's a squeezing. So that's number 1.
And so there's a spectrum of ways to describe it and to feel it, probably.
Absolutely.
Yeah. Okay.
Absolutely.
Chest tightness.
Chest tightness, chest pressure.
Just quick clarification, is it always on the left side?
No.
Okay.
No.
Because everyone's like, oh yeah, your heart's on your left, it has to be on the left.
You know, it's just somewhere across, you know, anywhere in the upper body.
Okay.
And then, so number 2.
Yep.
So number 2 is people may get short of breath.
Okay.
So really unusual shortness of breath often goes along with the chest tightness at the same time. Number 3 would be some sense of sweatiness. So out of the blue that you start sweating for no good reason. It's not hot.
So it's not like Southern Ontario, middle of July,
No.
humidity.
Yeah.
Okay.
No. And then palpitations.
Yep.
So you may feel that your heart's racing for no reason at all, like somebody's flicked a switch.
Okay.
And then nausea is another one. And those things often are all part and parcel of somebody having a heart attack. And there's all those features kind of can be together or a few.
Right. So you don't have to have all of them.
You don't have to have all of them.
Okay,
No.
can we just recap them? Chest pain.
Yep.
Shortness of breath.
Yep.
Palpitations.
Nausea.
Nausea.
And sweating. Diaphoresis.
Yeah.
Those are the broken heart symptoms.
They are.
Really?
I didn't mention crying.
Do you find people complain or loved ones say that their color changes? You know, you hear about that, I'm kind of pale or I'm kind of gray looking kind of thing.
So pale and clammy, absolutely.
Okay.
It may be there or may not be there. I think it's also important to say that women may sense some of these features less than others. So while still women, the majority of women may get chest discomfort or chest tightness, they're a little bit more likely to get some of the symptoms without chest discomfort. It may just be shortness of breath, for instance, that rather than chest pain.
Do you think it's because women are tougher than men?
Probably.
I think so, because of childbirth and stuff. They're just like, I'm just going to walk this one off. It's not like having a baby or dealing with my husband or whatever.
Yeah, but if you're worried,
yes.
The important point is if you're worried, it's never a bad thing to go to the emergency department or call 911. We're happy to kind of make that assessment and go, you know what, this wasn't your heart, rather than miss the ball.
Okay, so if I'm having some of these symptoms and I'm Googling this and I come across this video and I'm thinking, am I having a heart attack? That's what I'm looking for here for an answer. Yeah. The next question I'm going to have is, am I going to die? If I have a heart attack, will I die?
Wow, so that's
Well, you went right for it there.
Throwing it out there.
So 25% of people will pass away before they make it to the hospital. Wow. It's a terrible number, right? 1 in 4 people who have heart attacks will pass away at home. So that's a concern. We have come a long way in improving survival after heart attacks now, and with our advances, it's incredible. So, if you want me to go through that, I'm happy to kind of take you through.
Sure. Yeah.
Okay. So let's say you have a heart attack tonight, Paul, and you're getting.
Don't put that on me, Mike.
I know.
Don't wish that on me.
Put that.
An imaginary one. So you call 911. You recognize the symptoms we just talked about this morning, and the ambulance, they actually will do an ECG in your house, in your living room.
Okay.
And they're going to go, oh my gosh, this guy's having a heart attack. And they will direct you straight into the cardiac catheterization lab in an R region. We have these labs set up. you will get whisked into an angiogram suite, you get an angioplasty and open up the blocked artery right away, and that goes a long way to improving how you're going to do in the future.
So just give us a 20-second description. You're coming into angio suite, essentially in the wrist or the groin.
The wrist or the groin.
Put some dye to the coronary arteries, see the one that's blocked, and then potentially thread up a little balloon device and expand it.
Right,
So
with a little wire straw called a stent.
Yes.
And you leave that in there, it opens it right up.
So you open it up, you hold it up, and then that hopefully restores the blood flow.
Yep.
Okay.
And the reason is because a heart attack really is a blockage of an artery that's going to the heart muscle, basically,
Correct. Yep.
that stops that muscle from working properly.
Yeah, and the faster you can open it up, the more muscle you save,
Right.
the better you will do.
Overall survival rate if someone of heart attack.
So it really depends on how fast you got to the hospital and how much heart muscle we saved. But as a general rule, in the first 30 days after a heart attack, about 5% would pass away, and then another 5% in the first year. So about 10% in the first year. But that's all comers, and that's people that have had very small heart attacks to very big heart attacks. Right. So 90% chance that you will do very well going forward.
And then the key is if you make it to the hospital. So you've got to get to the hospital if you're having symptoms that are representative
worrisome. And it's okay to be unsure.
Especially in the time of the pandemic and people were worried about going to the hospital. The bottom line is you have to advocate for yourself. So if you're worried about this, get to the hospital. That's an awesome summary. Yeah. Awesome summary.
Right. Thank you very much.
So guys, if you like this, please like it. Subscribe to our channel.
Mike, we'll get you back to your poker game now.
Excellent.
And thank you for coming up and talking to us. And remember, you are in charge of your own health.
Don't you put that evil on me, Ricky Bobby. Don't you put that